Hello and welcome back to the White Paper channel. I'm doing this new thing where I'm recording the audios for this and then debating over which ones I want to use. I have a couple already made, so if you're listening to this, this is the one that I decided to choose. This is going to be kind of a ramble or a rant. It's not going to be as structured with perfect slides. I may develop graphic post editing if I think that it'll help people understand the concept that I'm describing. But without further ado, let's go ahead and get into it. So, first off, and most pressing, is we have the result release for the RSV vaccine, or the respiratory syncytial virus. And of course, everybody knows RSV is responsible for a significant portion of transplant failures in America. It's also responsible for a significant portion of deaths in the elderly, or I guess severe hospitalizations. It probably costs us billions of dollars every year. Currently, I think it's Pfizer, Merck, and GSK all have developed non-mRNA RSV vaccines. Some of them have actually come out; they're pretty good. Lower 80% vaccine efficacy. I will say they did not also include the fact that that is for severe disease only. And to be honest, I think when they weren't including some of the other things, I felt that they could have made the bar for qualifying for severe disease much lower, but I won't get into that today. In terms of how effective I think the Moderna vaccine will be, I think probably 90% or greater. When they release the results, if you see something in the high 80s, I would say that's positive. If you see, anything higher than that, that's even better. The first interim result release, and this is, like I said, this is a ramble, guys. This is, not quite as structured as I normally do. I've kind of noticed that Moderna likes to time their good news release with the timing of things that may adversely affect the stock price. So if you look back in December, we had some economic data release, and at the same time, Moderna released the personalized cancer vaccine data. And that's why when everything else was going down, Moderna was going up. So I would, be willing to bet that probably within the next, well, of course in this month, but probably like around the time the CPI data is released, I expect the release of the RSV vaccine data. Let's see. So we talked about what I expect, talk about when I expect it. Another thing that I've wanted to talk about is the Dream Factory, which nobody has asked me about. I've mentioned this a couple times. I've mentioned it in the Reddit post. I've mentioned it, I think, in at least one of the previous videos, and nobody's ever like, "Hey, what's this Dream Factory you're talking about?" So the way I think of the Moderna platform going forward is that it's going to be a platform that hosts scientific developments. So using genomic data for experiments or for drugs or et cetera, is not new, right? That's how we make insulin. That's how we make significant number of the products that we currently use. And it's how we make vaccines, even the ones that are non-mRNA. And these products could very easily be translated into mRNA. It would take them less than a day to translate their product from where it currently is into an mRNA form. And so instead of Moderna having to develop their own products, you're going to have a significant number of outside either pharmaceutical companies or just scientists that are going to be using the Moderna platform to make these products. Now, typically it takes about $1 billion to take a product from discovery to phase one. Using the Moderna platform, it cost about $300,000, maybe $1 million. So you can see the difference in there. So recently in the news, you heard about the University of Texas in Galveston getting the contract to develop a Ebola vaccine using the Moderna platform, and I think they were awarded like $25 million, which, normally that wouldn't sound like a lot of money, but now that you have the context of it'll only take them $1 million to get it from discovery to phase one, I mean, this is like free money here. Another great example is the HIV vaccine. So that was actually developed by a institute right outside of San Diego, called the Salk Institute, and that's actually so they moved their product onto the Moderna platform, and literally it went from them like signing the contract to like 8 months when it hit phase one trials. I remember like counting it, and it was just so remarkable. And that's because they already had the product, but moving that information into an mRNA form is just that easy. And then they were able to do all the mouse model experiments and everything to get it into phase one in 8 months. Another good example is all of their collaborations with Vertex. So Vertex is simply just designing a functional protein for cystic fibrosis patients. If you're not familiar, cystic fibrosis is a disease that affects a chloride transport protein that, when it doesn't work well, they have trouble clearing secretions, have trouble with their pancreas, etc., etc. And basically, Vertex just said, well, rather than trying to fix whatever small mutation you had in your protein, how about we just give you a very good functioning protein? And they teamed up with Moderna. They said, well, we've already had this product developed. And so they just simply turned it into the mRNA form and placed it on Moderna's platform. And that's why they're about to enter phase one trial. Like, it just, and so that's why I call it the dream factory. They're literally just going to keep pumping out all this stuff. And they don't have to put their own money into actually developing it. It's, in many ways, it's like an app store, right? Apple isn't paying all these people to develop these apps. People have their own teams developing these apps, and then they take it to the app store. And sure, Apple makes it available and gives them the tools and sells the product and takes a handsome fee for it. But everybody ends up rich, and everybody sees how successful Apple has been from that. That's a large part of Apple's margins, are all the ways that they have taken money off the top. And so that's really what I see this platform being. I see Moderna not having to chase after any of this intellectual property. People will bring it to them, and it takes almost no money to offer these services. So I guess those are the two things I wanted to ramble about. I guess we'll see if this is the one that I post.